Good morning, everyone, and happy Tuesday. Because of Valentine's Day and because it's also Heart Health Month, I wanted to talk a little bit about heart health, some foods that can help you, what to look out for, and what minerals are really important. So, foods that are high in vitamin E are very good for heart health because they lower free radical damage, and this includes leafy greens, so kale, spinach, all of those yummy things. Cruciferous vegetables, that's cauliflower, broccoli, carrots, all of that kind of stuff. Taurine is actually an essential amino acid for cats, but it's actually really helpful for heart health as well. You want a lot of vitamin C because it lowers inflammation, stress on the heart, which is berries, broccoli, and kale. So again, those cruciferous vegetables are really important, and the berries have a high amount of antioxidants. Vitamin A is really important to lower bacterial infections and basically boost the immune system. So this includes carrots, sweet potato, and dark green leafy vegetables. Again, if you're eating a lot of fruits and vegetables anyway, you're going to be pretty safe on this front. Going back to the taurine for a second, it's really important because it helps to dilate the heart. That's not right. Taurine is important because it helps with dilated cardiomyopathy, and it basically helps to regulate the rhythm of the heart. Heart disease is actually more common in dogs than in humans, which is beyond me because it's so popular in humans. I think it's 1 in every 5 or 10 humans. So for it to be more common in dogs is very concerning for me. I think that they're not getting enough vegetables in their diet to help them balance it out, or enough exercise, which would also lead to a higher risk of heart disease. So the symptoms of heart disease are lethargy, coughing, an increased respiratory rate, and they can't take a breath really easily, so the effort required to take a deep breath is higher. So you kind of see them almost not necessarily concentrating, but maybe the muscles around their chest are working harder. They'll have abnormally colored mucous membranes. So these are the ones, the easiest ones you'll see are in the gums. So if you lift up your dog's lip, you can see their gums. Most breeds have a healthy mucous membrane is pink. On some breeds, it's actually a black color, but if you press on it, the color should go away, and when you remove it, it should be less than 1 to 2 seconds before the color comes back. That means that the blood flow is good, the circulation is good, and you're less likely to end up with heart disease, which is also the capillary refill time. The longer the capillary refill time, the higher the risk of heart disease, because if the blood is not flowing through, that also means it's not moving toxins and plaque and all of those bad things out. Also, decreased appetite or weight loss. Can also be weight gain depending on how your body reacts to the symptoms. Collapse and edema. Edema is basically a collection of fluid that results in swelling in certain areas. In humans, this is usually in the feet because we're bipeds and we stand up, so the water flows down to the feet. In dogs, this is sometimes the legs, or if they spend a lot of time laying down, there can actually be swelling on the trunk. Congestive heart failure symptoms include a higher respiratory rate, especially when sleeping. So if your heart rate is supposed to go down when you're sleeping because your body's resting and not in an active state. So if you notice that their respiratory rate is higher when they're sleeping, then this is a good sign that their heart isn't working like it's supposed to. Coughing is another big one. If the person can't breathe through their nose and are constantly breathing through their mouth, this is another really good sign. Swelling of the abdomen, discomfort laying down, and if their appetite goes down. Those are all signs of congestive heart failure. There's 2 more important things that I want to talk about diet-wise. The first is omega-3s. If you are not getting enough omega-3s, you or your animal will exhibit muscle loss, appetite going down or appetite going up, and lots of arrhythmias. So if you're having all the important vitamins and minerals in your diet, don't forget to add omega-3s. I find some raw foods include it, but most of them, kibble or raw foods, actually don't include omega-3s. So it's really important to make sure they get them in their diet. Kaya's food was missing omega-3s, but I bought a supplement to go with it, and now she's doing much better on that. Last thing I want to talk about is sodium, because all the doctors always say to minimize your sodium intake when you have a heart condition or if you're at high risk for a heart condition. But I've actually talked to somebody with a heart condition, and he said that if you're not balancing that sodium level with potassium, then your levels are going to be really messed up, and those are the important ion channels in your body. So if you're going to lower your sodium intake, you also have to lower your potassium intake. Bananas are notoriously high in potassium, so whenever you eat something with a large amount of sodium, try and eat something that's also high in potassium to keep those levels pretty even. That's all I have to say about heart health. I hope that everybody had a safe and warm weekend. I know it was really cold. But it was Family Day weekend here in Canada, and we had Valentine's Day on Friday, so I hope you had a wonderful time. I do have another live video on Friday, and then I'm teaching this weekend, so we'll be a little bit offline for the next bit getting ready. But I hope you have a fabulous rest of your week, and I will see you on Friday.